Honourable Sophia Mormont.
Thank you, President. I thank my colleague, Honourable Dr Walker, for bringing this motion on today. It is an important discussion to have, and that would only be brought on by a party like the Legalise Cannabis Party here in WA. We are not afraid to tackle those issues which this government wants to ignore and put in the too hard basket. Drug injecting users are not often spoken about, especially in this place. Most people, the public and politicians, don't want to acknowledge that drug injection is still a thing. Isn't heroin all 1990s? Well, no, I'm sorry to shock you all, but those little plastic bins dotted around bathrooms, including in this place, aren't always used by those who must inject diabetes medication. Some are used to dispose of needles after injecting drugs, heroin, cocaine, other opioids and methamphetamine too. I understand that the discussion of drug injecting users makes some people uncomfortable, but aren't we supposed to have these difficult discussions here? I've highlighted the need for WA to investigate having a safe injecting facility here before. At one point not long ago, I directed a question without notice when the Leader of the House in this place was Health Minister. Also, the answer was, as usual, dismissive and short. The Minister said that the discussion was hard and it was concluded that WA didn't need such a facility. My question to this government, and indeed to the new Health Minister in the other place, is how many dead drug users would be enough for you to reconsider your position? 2 lives, 5, 20, 100? When would it end? As Dr Walker has highlighted, the Andrews Labor government launched a medically supervised injecting room 5 years ago. It took great political courage. It was in response to scores of deaths a year that had, It was in response to scores of deaths that year that had occurred from overdose in the inner city, most notably around the suburb of Richmond. Just recently, a final report was handed down on the effectiveness of the program, and the facility has been made permanent. It hasn't been an easy policy to introduce, mainly because the public, being stirred up by some ignorant politicians who don't want to face facts, don't have a lot of sympathy for drug injecting users. They are bottom rung on society's ladder. But since its establishment, the medically supervised injecting room in North Richmond has succeeded in achieving what it set out to do. The policy at the centre of its objective, saving lives. 6,000 overdose events in the facility during the trial, and none, that's right, none, have been fatal. As the Ryan report recently noted, dealing with drug addiction in the community is a complex task, in large part because it requires people with complex needs to interact with a complex web of social, legal and other support systems. Policy makers committed to addressing addiction must find solutions within this complexity while balancing a set of sometimes competing aims, including preventing deaths, promoting health, offering pathways out of addiction, protection, safety and amenities, and generating community support. The report went on to note that supervised injecting facilities aren't a silver bullet, and that needs to be made very clear. This isn't a fix at all, but one tool, and a seemingly very successful one that the data shows has a real impact at saving lives. There's a growing body of evidence, including from supervised injecting facilities established overseas, that this type of intervention reduces deaths. It's that simple. It also substantially reduces syringe litter, which is in itself a problem, especially for children. Supervised injecting facilities also give highly vulnerable and disadvantaged members of the community better access to vital social and health support. It is because a safe injecting facility run by medical professionals without judgment is a wraparound, enveloping type of service. Once the user is in the facility, they can be offered other opportunities to help them in their pathway to recovery. Things like housing services, addiction treatment, dental, legal and mental health services. At its heart, an injecting service is a health response, its main objective to save lives. Yet, unlike other evidence-based health policies that prevent death and provide life-changing support, injecting facilities are often highly contested in the public conversation, as the Ryan report stated. But let's be honest, they shouldn't be. Everyone should have access to good health care, not just those who we like, also those who we may be judging on the way they look or the way they present. As has been stated, safe injecting rooms drastically reduce ambulance call-outs and presentations at emergency departments. Also, such a facility is a fantastic tool in reducing the spread of blood-borne diseases, including HIV and hepatitis C. Safe injecting facilities are a huge harm reduction measure. The data is clear both in Australia, where we have the Melbourne example, and a 2 decades plus King's Cross safe injecting facility example, and from overseas in places such as Canada. Put simply, safe injecting rooms work. Harm reduction is grounded in justice and human rights. It focuses on positive change and on working with people without judgment, coercion, discrimination, or requiring that they stop using drugs as a precondition of support. And President, we practice harm reduction in other areas all the time. Why should it be different for drug injecting users? You know, we have seatbelts as a harm reduction measure. We have plain packaging on cigarettes as a harm reduction measure. Alcohol tax increases and warning labels on bottles are harm reduction measures. Some may remember when a bad batch of drugs hit Perth in 2019. 3 people died and scores of others hospitalised. If those people had been in a facility that was medically supervised, then there's a 100% chance they would have survived. Obviously, that would have benefited them, but also their family and possibly their children. And when I was in an RN in Amsterdam, I saw the effect of heroin addiction on babies. When I was on this particular ward, I saw 3 babies that went through withdrawals. Their screams as they were detoxing were horrible, loud and piercing, and I will never forget that. They were the babies born of sex-trafficked, heroin-addicted women. They were addicted to heroin to help them be controlled by their sex traffickers. They were made addicted on purpose for that specific reason. Now, providing people with support gives hope. A lot of people with addiction lack hope. They don't have anything to look forward to in their life. People with hope can make change. People without hope are unlikely to have the desire to do so. They want to escape reality. They want to escape the pain. By having appropriate healthcare services and social support services, we can give those people hope, give them the motivation to give up their addictions, help them see that their life can have value. Now, how many deaths of those that we marginalise, of those in the shadows, those in the grip of a terrible addiction, will it take for this government to consider trialling a safe injecting facility in WA? Healthcare should be for everyone. Thank you.
Members, the question is